So people are wanting to know what can cause pain that's located at the back of the knee. And there are very few things that we can kind of isolate. When a patient comes in and says that they're having knee pain, but it's all located on the back of the knee, there should be several things that kind of come to mind. The first and most common thing is what's called a Baker's cyst. With wear and tear of the joint, you can get a little cyst that kind of forms with a little bit of what we call synovial fluid. The joint has a little fluid lining, and over a long period of time with arthritis and degenerative changes of the knee, cysts can start to form, and it grows in the little space behind the knee. And sometimes patients can even feel it. If you put your fingers behind your knee, you may be able to feel like a bulge, and this could be quite painful, and that pain is usually located on the back of the knee. The other more common thing is posterior cruciate ligament. So everybody knows and hears about ACL tears, especially with athletes, but there is another ligament called the posterior cruciate ligament, and when that's damaged, it can cause pain isolated to the back of the knee, and you may not even really realize it. And this may not necessarily come from an injury that happens all of a sudden. Posterior cruciate ligaments or injuries to this ligament can happen over a slower period of time, and so that pain can slowly kind of develop. Lastly, good old arthritis or osteoarthritis sometimes can be found with just pain that's at the back of the knee. Now, these are all the causes related to the knee joint, but there's one really important one that even could be dangerous to the point of being fatal, and that is getting a blood clot in the popliteal vein, which is the big vein behind your knee. If you get a clot in that vein, it's going to cause pain. But more importantly, if this clot breaks off, it could go to the lung and it could be fatal. So especially if you notice pain in the back of your knee after a long travel, like on a flight or a long car ride, and you start to notice pain at the back of your knee, you definitely want to go to the emergency room and get it checked out with an ultrasound, because we do not want you to be missing the diagnosis of having what's called a DVT or a blood clot in that popliteal vein behind the knee. In any event, if you're having any of these types of issues and you're looking for answers, feel free to call our office or make an appointment to see somebody in our facilities where we can guide you and get you the diagnosis and, more importantly, the treatment that you need, especially if you're dealing with this isolated back of the knee type of pain situation. With that, I'll say thank you. Take care.